Today, we're diving into vestibular rehabilitation and its role in managing vestibular disorders. We'll explore the goals of this therapy and focus on the classic Cawthorne-Cooksey exercises. Vestibular rehabilitation is a customized exercise program designed to alleviate dizziness, improve balance, and restore normal function of the vestibular system. This therapy is crucial for patients with conditions like vestibular neuritis, Meniere's disease, or post-concussion syndrome. Absolutely. The key idea is habituation, reducing the response to repetitive sensory stimuli. This helps patients gradually adapt and reduce symptoms like dizziness and imbalance. The primary goals include improving functional balance, decreasing fall risk, and enhancing the vestibulo-ocular reflex, VO. This allows patients to stabilize their gaze and maintain focus during head movements. Another major goal is improving sensory integration, helping patients better interpret and respond to sensory information, and ultimately decreasing symptom severity. The Cawthorne-Cooksey exercises are a foundational component in vestibular rehab. They involve a series of head, eye, and body movements aimed at desensitizing the vestibular system. Let's break down some examples. For instance, head exercises might include simple motions like nodding or turning the head side to side, performed with eyes open or closed. Then, we have eye movement exercises where the patient keeps their head stationary, but follows a moving target with their eyes, improving their VO. Positioning exercises can be as straightforward as turning the head while seated or rolling from side to side while lying down. These help patients regain confidence in their movement. Postural exercises are more about balance, like standing on one leg or walking in a straight line. Over time, these exercises reduce fall risks and improve gait stability. Of course, a one-size-fits-all approach doesn't work here. The exercise program should be tailored to the individual's specific deficits and symptoms. And that's where modern vestibular rehab differs from the early days. It's now more about customizing therapy based on detailed assessments, incorporating both subjective symptoms like dizziness and objective measures like postural instability. To wrap up, vestibular rehabilitation, especially with Cawthorne-Cooksey exercises, plays a critical role in helping patients regain balance and reduce dizziness. Through regular practice and customization, patients can significantly improve their quality. Thank you for tuning in. We hope this discussion provides you with deeper insights into vestibular rehabilitation and its impact.